how are you today?
Good.
Practicum begins. So my name is Kirian. I'm a nursing student of Trinity Washington University. I'm here today to do what is called head-to-toe assessment. Is that okay by you?
Yes.
Okay, that's good. So, but before I start, can I wash my hand? Wash my hand, do hand hygiene, and I provide privacy for my client. Okay. Okay. So, before I start, can you tell me your name?
Osioma.
What about your?
My Grace Arachi.
Okay, good. What about your date of birth?
January 10th, 2013.
That's fine. Do you know the month we're in?
April.
Okay, good. So, how about the name of the immediate past president of U.S.?
Oh, wait.
I asked.
Obama.
Oh, Barack Obama. Okay, that's cool. So my patient is oriented ×4 because she was able to tell me her name, her date of birth, the name of the immediate past president of the United States, and then the month we're in. And going by the clothes she's putting on, she's appropriately dressed for the weather. And I'm standing beside her. I don't smell any foul odor. So she's well alert and her facial expression is good for a child of her age, conduct-wise. So I would say my patient is oriented ×4. So having done with this section of the test, we have to move to the stage where we have to check your height, measure your weight, and then check your vision to see how far you can see. Is that okay? Okay, I know you're a little bit tired, but let's. Okay. Now, which one do you want us to do? The height or the weight? Height, okay. So you stand here. Okay, no problem. Okay, here. Measure her height. Okay. Her height. Next, the weight. Stand on the scale. If it works or not, that's fine. So it says 86 pounds. Measured, okay. Try again, okay. That's fine. Don't forget what I told you. So this is 86 pounds, that's fine. So next, follow my instruction. Stand on the line. I assume you are standing 20 feet from the chart. Okay, no problem. So cover your left eye. No, your left eye with your left hand. So fifth line, this one.
No, don't go like all of it.
Okay, so do you see this letter?
E.
What letter is this?
T.
What about this?
D.
Okay, so on this line, do you see this letter?
Wait.
Same eye, the same eye. Yeah.
D. C. P.
Okay, so my client is able to see 20/20 with the left eye, with the right eye. So cover the right and read with the left. What letter is this?
P.
What about this?
Go higher. Go higher. Go
Hold on,
higher.
no.
C.
What, on this?
Go higher. No, like that.
What letter is this?
F.
And this?
D.
Okay, what letter is this?
E.
And this?
O.
Okay, so my patient is able to see on both eyes 20/20, which means she has good vision. Okay, so we have to go to the next step. We're following everything step by step, okay? So stand by this line again. Now close this eye, close the ear. No, you are following my instruction. Cover this nose. So I'm standing 2 feet. Sorry, cover your ear. I'm standing 2 feet behind you. I'm going to whisper. You tell me loudly what you heard, okay?
Okay. Thank you.
Next, I want you to tell me loudly, louder than before, what you heard.
Grandpa.
Oh, that's cool. So now, next thing, you have to bend down. Let me assess your spine to see. Hold on. You feeling any pain?
Nope.
Any pain?
Nope.
Okay, that's cool. Stand up. Next, I want you to, can you face me this way? Turn around, turn around. Okay. Your legs, your two legs together, your feet together. You said you won't do this. Yeah. Now put your hands by your side, close your eyes for 10 seconds. Read. Count 10 seconds in your mind. Stand straight with your eyes closed, with your 2 eyes closed. Ten seconds.
Oops, yeah, really late. I forgot my eyes.
Yeah, 0. Okay. Now let's do it again. With your 2 eyes closed for 10 seconds.
I counted to 20 fasting.
Okay, that's fine. That's fine. Next, stand here. Close your eyes. Close your eyes. Okay, open your eyes. Watch what I do.
Okay, now I understand, but why are you putting it there?
That's to nose. Hand, nose.
Okay, I understand.
Okay, good. I wasn't swinging. Okay. Okay, that's fine. Next, do the heel to chin. Watch what I do. Watch what I do. Heel to chin. I'm not holding anything on the wall. This is what I do. Watch my toe. Watch my toe.
I understand.
Okay, go back. Start from there. Heel to chin. Heel to toe. Heel to toe. Keep going. Okay. Okay, that's cool. So, okay. Now the height. We've measured the height already. Okay.
Yes,
we
we
did it,
have.
we did it, we did it. We did the height. Get back here.
That was supposed to be
Okay, so
tripwire.
sit down here. So we are back from the test for her vision, her height, and her weight. So we will get to where we have to check and assess her blood pressure. But before I assess her blood pressure, I have to check her heart rate, respiratory rate, or the radial pulse. So let me check your radial pulse. Which hand do you prefer? Right or left? Say it out. Which hand? Your right hand? Okay, that's cool. So let me check.
Okay.
Don't do this. Let me do the radial pulse. We have to do it once and finish, okay? I'm checking your radial pulse. I'm looking at my watch.
How many numbers do you count?
Count up to 30 seconds.
Wait,
And
no,
then
I mean
multiply by
like
2.
this. 1, 2.
2, 3. No, I move with the stick. This hand with the second hand.
I mean like big numbers, like this type of numbers.
Okay, so I've been able to count up to 30 seconds, multiply it by 2 because she has a regular radial pulse. So, and I was equally observing her respiratory rate. So she has a radial pulse of 85 beats per minute, and her respiratory rate is 16 breaths per minute. So next I will check for her pulse oximeter. Before I do that, did you drink anything hot in the next 15 minutes?
No.
Okay, good. So
In the next?
in the last 15 minutes, sorry. In the last 15 minutes, yes or no?
No.
Okay, good. So now I have this
Why,
mock
why did you
oximeter.
ask me the question?
Because if you drink something hot or cold, it will affect the oximeter reading or the temperature. You understand? Okay. So let me check this. It's make believe, okay? So this is the pulse oximeter reading. That's fine, 6 flags.
I want to do this.
Okay. Pulse oximeter reading. So I want to assume my pulse oximeter reading is 98% oxygen saturation. Next I have to check your temperature. And I'm using the
the temperature stick.
Yeah, the infrared temperature to check on your temporal measurement, okay?
Okay.
Okay, so don't worry, we'll soon finish. Now I'm scanning.
Wait, you're supposed to go from here to there.
That's what I'm doing.
No, you're not.
Take your hand
there.
off. Take your hand off.
Start there.
Okay, take your hand off.
Can I see?
Okay, so it's
Can I see?
98.2.
What didn't work?
95.6, okay. So the temperature is 95.6. So next I have to do my hand hygiene, don my glove, and then assess her head, check for symmetry, pipette, check for lumps and masses and depressions. Is that okay? So I wash my hand. Don my glove. Alright, you said you won't do this. You said you won't do this again. So now I'm checking her head to make sure there are no lumps, no bumps, no masses, and no depressions. So in addition to that, I'm equally observing the size of her head. It is proportional relative to the rest of her body for a child of her own age. So there are no issues. I'm equally observing her neck and her cheeks. The colorations, there is no discoloration. Now, can you bend backwards a little bit? Can you hyperextend? I'm checking her neck for checking the thyroids, checking her trachea. No lumps, no masses. Everything is within normal limit. Everything is okay. So I have to take off gloves. Perform hand hygiene. Next, I have to check the sinuses and the nodes. So I start with the pre-auricular node, post-auricular, supracervical, posterior cervical, posterior auricular, supraclavicular, posterior cervical, submental, submandibular, then frontal sinus, maxillary sinus. Do you feel any pain?
No.
Okay.
Isn't there one of those parts?
Okay, you didn't feel any pain. So next I have to check the carotid artery. Can you take a deep breath?
I took a deep breath already.
Okay. And hold it. Next. Carotid artery is bounding ×2. Now I have to use the bell and the diaphragm to check the carotid artery, starting with the diaphragm.
Is that the larger part?
And then I will use the bell
Oh, that's the smaller part.
to auscultate the carotid artery. Then I'll check the other one. Can you stay still?
Is that the bell?
Yes, it's the bell. I'm listening to the sound to see if I can get any sound, yeah, from the carotid artery. Okay.
You didn't do about this one.
Hold up. Next, I have to check your blood pressure. Okay. First, I have to establish a baseline. Don't worry, within 2 minutes, we are done with this one. Check your baseline.
It's not tiny enough.
Don't worry, it will be fine. You start now, right?
Yep.
So you have a baseline of 110. So I have to bump it up to 140. And then you measure your blood pressure.
That's 60.
Don't worry. 140. See that?
Yeah.
Okay, then hold on. Keep your hands steady. You said you want to do this. I'm reading your blood pressure. Don't worry. Okay, so your blood pressure is 100/70, which is good. So 100/70. So next, that takes us to check your eyes. Okay. I wash my hand again. And I use my pen light, and then can you look up a little bit? I pull the conjunctiva. I observe the conjunctiva. Can you look up? No, look at me first. Look at me straight. Then look up. That's fine. So the conjunctiva appear warm.
Whoa, I can do it for you.
Okay, so hold on first. I check the eyes. The palpebral fissures are okay. They are equal. Then, can you look up? Okay, that is good. So the bulbar conjunctiva is white and the palpebral conjunctiva is pink. The cornea is avascular. Everything looks normal. They are equally positioned on both sides of the face relative to the ear. So everything seems normal. So I have to check the eyes for accommodation, and then check the size of the pupil. So now look at me. Okay. Now look at me. Look behind me. Look at me. Okay. Now open your eyes. Cover this one. Cover one eye. Now look at me. Look behind me. Look at me. Look behind me. Cover this one. This one. Look at me. Look behind me. Look at me. Look behind me. Okay. With the two eyes now, hold on. Okay. So sit here. Now, can you look at this? As I bring it in, keep looking at both of them. Alright. So, can you follow this light? So, having assessed my client's eyes, I can say that she exhibited pallor. This stands for her pupils are equal, they are round, and they react to light and accommodation. And the pupils of both sides. Like I said before, the cornea doesn't have any vascularization, which is okay. So, and she was able to follow the direction of my hands as I move it in the H pattern, assessing for the ocular motility. And when I did the confrontation field, she was able to move binocular vision. So, can you tell me, close this eye, cover this eye, what? Tell me when you see this.
Yes.
No, when you see it, when I bring it
I
in.
can actually see it. Yes.
What about now?
Yes.
Okay, hold on.
Yes.
Close this eye. When I bring it in, hold on, look at me, keep looking at me. When you see it, you let me know.
Yes.
Okay.
Yes.
Hold on, look at me.
Yes. Yes.
Okay, that's fine. So her eye seems to have a very wide visual field. That's why before I could even bring it up, she would tell me yes, she sees it. So next, I have to check the ears. Okay. Oh, the nose. So let's look at the nose. Grandpa's nose.
I know.
So I was able to check her nose. It appears nice, positioned at the midline of the face. Sit up. See, you see it. It appears fine, positioned at the midline on the face, and it is symmetrical with respect to the two ears. I looked with my light inside the nose. The ears appears pinkish. The septum is well divided. There is no narrowing. There is no deviation of the septum. They are equally divided the nose into two nostrils, which is within normal limits. Next, I have to check the ears. Put your legs down. Soon we will finish.
Hey, I'm going this way.
Hold on, no.
See this?
Okay. No, I can turn around. I'm checking the outer ear. Just look at me. I'm checking the outer ear for tenderness. Do you feel any pain?
No.
Any pain?
No.
Okay. Turn the other one. You feel any pain?
No.
Okay. So I have to use my Moog otoscope to check the inside of the ear. Okay. Turn around. The other one. That's fine. So I was able to check the inside of the ear and the outside. So the ears appears equally aligned on both sides with the eyes. I palpated the ears for bumps and tenderness. It was okay. I asked my client if she feels any pain. She said no. The otoscope, which I did, even though it's a Moog otoscope, being a child, I had to pull the ear down and out to view the tympanic membrane, which appears purely gray in color. I was able to see some wax, which are just normal. So with that said, that takes us to the assessment of her sense of touch and feel, which is assessing the cranial nerve 5, the trigeminal nerve. So before I do that, I wash my hands still. Wash my hand. So can you trigeminal nerve. Okay, so looking at your cheek. Can you tighten your teeth for me? Can you clench your teeth for me? Puff your cheek. Frown. Smile. Squeeze your. Okay, that's cool. Next, I will don my gloves. To assess the mouth. We're getting there. So that's really okay. Can you open your mouth? Let me check. I'm observing her mouth. It appears moist. The teeth are intact. I'm checking her tongue. So can you raise up your tongue? Move it sideways. Up, down. Okay. I'm observing her uvula going up and down. No, put your tongue down. Do just open your mouth. Ah. Okay. Now I use a tongue depressor. So this is a real tongue depressor.